Hi, my name is Andrea Fava. I am a lupus doctor and I direct lupus translational research in the Division of Rheumatology at Johns Hopkins. And in this year ACR, we are going to present a couple of abstracts about research I'm very excited about. And this is about using urine proteomics, and I'll guide you through it. Let me start by the disease we're studying, that is lupus, which is an autoimmune disease that can affect the whole body. But we focus in particularly on kidney lupus, which among the million manifestations of lupus is the most common of the bad ones. And why is it bad is because it has a very high risk of leading people to end-stage kidney disease, which means dialysis or transplant if left untreated. But in order to treat it appropriately, we need to diagnose it. And there's a problem there because more than 50% of the time there are no symptoms. And so what do? We check for abnormalities in the urine of patients that come to clinic, and if there's too much protein in the urine, we react with a kidney biopsy. Now, there's a problem with that because the protein in the urine does not tell us if there is inflammation in the kidney. It does not distinguish scar tissue from inflammation. And so we have to do kidney biopsies that, of course, they are very helpful, but they are invasive. And then we start treating, and how do we assess response to treatment? We still use proteinuria, but that can fool us. And so sometimes we have to repeat kidney biopsies, but again, we don't want something invasive. And so urine may be the answer because urine collects the byproduct of kidney inflammation in real time. And in the last year, we've been developing tools to assess the degree of kidney inflammation in the urine non-invasively. And we could by using that, we could both do discovery to understand new mechanism of disease, as well as develop a biomarker, meaning a new diagnostic or monitoring tool. And the first abstract was focused on what we call class 2 lupus nephritis, which is a milder, at least considered milder form of lupus nephritis, a very early form of kidney lupus. And what we found is that despite lupus class 2 being considered mild, we found a lot of features of inflammation in the kidney that actually were similar to the degree of inflammation that we see in patients with much more advanced lupus nephritis. And so that is providing us a window into early stages of disease that look like later stages and perhaps can help us drafting new treatment approaches. The other abstract is quite fascinating. Because we are relying on kidney biopsies to tell us whether or not there is inflammation in the kidney, we have developed through machine learning and artificial intelligence tools a set of biomarkers, which is a group of protein in the urine that when measured together, they can tell us with very high accuracy whether or not there is inflammation in the kidney. And we tested it, we validated it, and then what we found is that it performs incredibly well. It's more than 90% accurate, which is quite astonishing. The beauty of this new tool is that, first of all, it can be tested non-invasively, just in the urine, but it can be tested multiple times. Can you imagine having to get a kidney biopsy every 3 months? That's something that we would never do. But with this assay, we will be able to check multiple times, any times we need, whether or not there is residual inflammation. That's important because if I'm treating someone with a potentially toxic medication, I want to know right away if this medication is reducing inflammation effectively. And even after a couple of years or 3 years of treatment, if I want to know if it's safe to stop that medication, I need to know if the inflammation is gone. And so this assay and this tool we develop is opening the door to finally develop a tool that is available to everyone once developed that could really change the way we manage disease. Thank you for listening. I hope to see you at ACR 2024. The abstract about the new diagnostic tool will be presented at one of the plenary sessions. It's going to be plenary number 2 on Sunday morning. See you there.